Speech is about weight loss surgeries. So it's a little bit technical. I'll introduce it first. Difficult words will be restrictive surgeries. En français, chirurgie restrictive. Sorry, I don't know it in Spanish. Then we've got ounces, so measurements, ounces and pints. Bypass, potage gastrique, j'ai trouvé. Non, potage non, hein? Ok. Je vous laisse faire. Pontage, pardon. Potage. J'avais marqué le N. Pontage gastrique. Sorry. And then we have malabsorptive surgeries. Chirurgie de malabsorption. Voilà. Then gastric binding. Ça, j'ai pas trouvé en français. Saline solution, sérum physiologique. Gastrectomy, ablation de l'estomac. Blood clots, caillots de sang. And heartburn, brûlure d'estomac? Oui. And then a dumping syndrome, which I didn't find in French, but you'll understand from the context, hopefully. And the last one is gallstones, calcul biliaire. Okay, so the reason I chose this topic is because I hear increasingly that there are people who wish to lose weight and they've tried and tried again and again to lose weight by dieting, but haven't managed. So their last resort is surgery. And quite a few people I know have had a form of restrictive surgery to help with weight loss. I will go through 3 types of restrictive surgeries. There are many more. The key idea behind this kind of surgery is that it shrinks the size of the stomach and slows down digestion. A normal stomach, in fact, can hold about 3 pints of food. After surgery, the stomach may at first hold as little as 1 ounce, although later that could stretch to 2 or 3 ounces. The smaller the stomach, the less you can eat. The less you eat, the more weight you lose. Now, restrictive surgeries change how you take in food. They give you a smaller stomach and also remove or bypass part of your digestive tract, which makes it harder for your body to absorb calories. Doctors don't purely do malabsorptive surgeries, which are also called intestinal bypasses, and they don't do them anymore because of the side effects. Implanting an electrical device is the newest of these techniques, and it prompts weight loss by interrupting nerve signals between the stomach and the brain. So then let's look at the details of 3 types of surgery. The first one is gastric binding. The name says it all. It is a type of restrictive weight loss surgery. How does it work? The surgeon uses an inflatable band, a little bit like an elastic band, to squeeze the stomach into 2 sections, a smaller upper pouch and a larger lower section. The 2 sections are still connected by a very small channel, which slows down the emptying of the upper pouch. A little bit like a cow, I think. That's my addition. Most people can only eat a half to 1 cup of food before feeling too full or even sick. The food also needs to be soft, or well chewed, so slowly. The pros of this kind of surgery are that it is simpler to do and safer than a gastric bypass or other operations. You also get a smaller scar, recovery is usually faster, and you can have surgery to remove the band if you change your mind. You can also get the band adjusted in a doctor's office. To tighten the band and further restrict your stomach size, the doctor injects more saline solution into the band. To loosen it, the doctor uses a needle to remove liquid from the band. The cons of this kind of surgery are that people who get gastric binding often have less dramatic weight loss than those who get other surgeries. They may also be more likely to regain some of the weight over the years. And there are also some risks. The most common side effect of gastric binding is vomiting after eating too much too quickly. Complications with the band can happen. It might slip out of place, for example, become too loose, or even leak. Some people need several surgeries. As with any operation, infection is also a risk. And although unlikely, some complications can be life-threatening. The second type of surgery is called gastrectomy. This is another form of restrictive weight loss surgery. In the operation, the surgeon removes about 75% of the stomach. What remains of it is a narrow tube, also called a sleeve, which connects to the intestines. Sometimes gastrectomy is a first step in a series of weight loss surgeries. For some people, it's the only surgery they need. So they don't need other types of surgeries. The pros of this kind of operation are for people who are very obese or sick. Other weight loss surgeries may be too risky. A gastrectomy is a simpler operation that gives them a lower risk way to lose weight. If needed, once they've lost weight and their health has improved, usually after 12 to 18 months, they can have a second surgery, such as a gastric bypass. Because the intestines aren't affected, a sleeve gastrectomy doesn't affect how your body absorbs food, so you're not likely to fall short on nutrients. The cons are that, unlike gastric binding, a sleeve gastrectomy is irreversible. Since it's relatively new as a technique, the long-term benefits and risks are still being evaluated. Typical risks include infection, leaking, and blood clots. The third type of surgery is gastric bypass. This is the most common type of weight loss surgery. It combines both restrictive and malabsorptive approaches. In the operation, the surgeon divides the stomach again into two parts, but this time they seal off the upper section from the lower. The surgeon then connects the upper stomach directly to the lower section of the small intestine. Essentially, the surgeon is creating a shortcut for the food, bypassing part of the stomach and the small intestine. Skipping these parts of the digestive tract means that the body absorbs fewer calories. The pros are that weight loss tends to be swift and dramatic. About 50% of weight loss happens in the first 6 months. It may continue for up to 2 years after the operation. Because of the rapid weight loss, conditions affected by obesity, such as diabetes, high blood pressure, high cholesterol, arthritis, sleep apnea, and heartburn, often get better quickly. The cons of this type of surgery are that you won't absorb food the way you used to, and that puts you at risk of not getting enough nutrients. The loss of calcium and iron could lead to osteoporosis and anemia. You'll have to be very careful with your diet and take supplements for the rest of your life. Another risk of gastric bypass is dumping syndrome, in which food dumps from the stomach into the intestines too quickly before it's been properly digested. About 85% of people who have a gastric bypass have some dumping. Symptoms include nausea, bloating, pain, sweating, weakness and diarrhea. Dumping is often triggered by eating sugary or high carbohydrate foods, and adjusting your diet can help. Unlike adjustable gastric binding, a gastric bypass is generally considered irreversible. It has, however, been reversed in rare cases. The risks of this surgery are that because gastric bypasses are more complicated, they're also riskier. Infection and blood clots are a risk, as they are with most surgeries. Gastric bypass also makes hernias more likely, which may then need further surgery to fix. Also, you may get gallstones because of the rapid weight loss. Now, there is one technique that is my personal favourite, and that is called willpower, which really helps you lose weight without having any side effects.